The topic is a colorful topic, which is rainbow on the food plate. To chair the sessions, let me call upon Dr. Ramgopal Chejara, sir, our present TAP president and a practicing pediatrician and neonatologist in Thane, Dr. Sachin Biradar, our past secretary TAP and consultant pediatrician and neonatologist. I request our chairpersons to call upon our speaker for the day.
So today's our chief guest is Dr. Upendra Kinjawadekar, sir, and I am honored to introduce him, but I don't think he requires any introduction. He is like our own branch member. So sir, I invite you on the stage. He is the owner of Kamlesh Mother and Child Hospital, Nerul. He is attached to Apollo Hospital and is almost 30 years in clinical practice. And I congratulate him to be the president-elect for IAP 2022. And he is a treasurer NCDPA 2021, EB member of ID chapter 2010 and 14, member secretary parental guideline 2021. And special interest is infectious disease, nutrition, vaccinology, pulmonology, and general pediatrics. Sir, over to you.
Yeah. A very good morning, friends. At the outset, I thank the organizers for their kind invitation. But before that, I express my gratitude to each one of you TAPians for your trust and faith by choosing me as President-elect of Indian Academy of Pediatrics. You're all great friends. I am not feeling different because Navi Mumbai, Thane, we have always worked together. So it's like one branch. The topic assigned to me today was by Dr. Suhas Kulkarni. He said talk about rainbow on food plate, and also he has given one annexure to me also to talk about it, about which I will come to it a little bit later. So rainbow in the sky, always a delight to our vision. We all feel fresh. There is a smile, happiness whenever we see a rainbow in the sky. But that is not giving anything else apart from the delight to the eyes. But rainbow on a food plate, a different display of colors, not only gives a delight to the eyes, but power-packed nutrients make it so nutritious and extremely useful for each one of us, not only to the child, but each one of us present over here. So it is ultimately talking about the micronutrients which sir was talking about now. But before going ahead, let's take a look back on pandemic, what it has done actually. Number of the starvation we know, the number of people, children had to undergo. Inequitable distribution, the migrant population, though they had the food, but that was not equally distributed everywhere. Picky eating just picked up in last 2 years tremendously, which is non-nutritious kind of junk food. Buying OTC medicines went skyrocketing up, and not only the over-the-counter multivitamins, but the so-called immune boosters, which had so many multivitamins, but in extremely high proportion, and we felt just blindly we started taking it. And of course, the junk was always there. Ultimately, we all started up with the pandemic with some recipes of cake being shared everywhere. The production and consumption everywhere increased, but at the cost of something which was really very healthy. And last but not the least, the overweight and obesity, which was up till now only 2% per year, again jumped up to 20% per year. So we are talking about a healthy rainbow on plate, but before giving an advice about it, let's know that this is the ground reality as far as COVID is concerned. So why should we talk about it? Basically, we know as pediatricians, I'm more bothered about the physical growth, the cognitive development of the child. As a nation, I'm more interested about reducing the morbidity, but look at it, after 18 years of age also, the daily adjustable disability life years go down, decreased work production in adulthood, so long-standing consequences of micronutrient deficiencies, even if it has occurred in an early age group. And let's take a pause and talk about this human hunger index score. So what is this hidden hunger index score, which is basically, these are a list of countries which are performing worst. And can you see where India stands? It is on the 7th position. And which are the countries worse than us? I have not even heard of this Central African Republic or Benin or Sierra Leone. These are still worse problems, but something better, the Burkina Faso, Sao Tome Principe. Have you heard of these countries? They are a little bit better than us. So what is happening? How this score is derived? Basically, 3 parameters are taken. They talk about hidden hunger score by doing a zinc level, which tells you about stunting. They talk about low serum retinol. We know it is very important, vitamin A. And of course, the anemia. So only 3 parameters, even if they are taken, it will ultimately tell us the human development index score. And look where we are. And the amount of work that you and I need to do in next couple of years, the amount of hard work which was done previously has got washed out. So we need to really pull our socks up and again start working on this. Talking about micronutrients, all of us know that these 7 are most important. And though sir said that copper and selenium, everything is really important, it's beyond the scope of a talk when it is given to in a 20 to 30 minutes. So zinc, folate, iodine, iron, B12, vitamin A, and vitamin D are the master micronutrients that we can take care of in our day-to-day practice. And let's see how the conditions and the ICMR recommendation help us in doing so. So look at this, the recommended dietary allowances. I talk about only iron and vitamin D. We need to know that iron requirement is only 8, 16 and 32 are the 3 figures you need to remember as far as daily allowance is concerned. 8 is for 1 to 3-year-old, 16 is for 10-year-old, and then finally 32 for 16-year-old. So if you remember these 3 figures, 8, 16, 32, you can give the recommendation to your patients. Talking about vitamin D, it is only 400 IU we say that it is still first birthday and 600 later on. There is no need to remember rest of the figures because they are quite easy. But mind you, a word of caution about tolerable upper limit, which you have often ignored. Talking about iron, the tolerable upper limit is 40. So we cannot go beyond that in a healthy state. So 40 to 45 the max. So forget the dose of 3 to 6 milligram per kilogram. Let's stick to 3 milligram per kilogram. That is the amount of iron in deficiency. Of course, these are the levels in a healthy state, but mind you that we can always go overboard. Talking about vitamin D, the maximum upper dose which is recommended is 4,000 international units. You multiply it by 30, it makes 120,000. A 60,000 sachet maximum twice. So unnecessarily we are not consuming too much of vitamin D, just popping up those sachets just because, or a small tablet or a bottle. So mind you that there is a, unintentional overuse of certain micronutrients is also detrimental for the child. So where can a pediatrician influence in all this journey? Let's remember when we give a dietary recommendation, there are 7 food groups that all of us need to remember. And they are nothing but grain, roots and tubers. They are all eggs, legumes and nuts, dairy products, fruits and vegetables, vitamin A rich fruits and fleshy foods. But out of which, if you can say out of these 7 groups, you can see the non-vegetarian consume about 2. So we know that most of our patients are vegetarians. Even if they are non-vegetarian eaters, India is extremely different as compared to the West. There when they say a non-vegetarian, he eats every day. आपल्याकडे फक्त बुधवारी आणि रविवारी खातात. So most of our patient population, even if they say that they eat non-vegetarian, it's not every day or every meal of the day. So we need to be careful about giving this advice, and about 60% of our population is exclusively vegetarian. So we must put an attention to that. And then going ahead, look at this family health survey which has shown that though our exclusive breastfeeding rates have gone up, a pat on back to each one of you, but at the same time, look at that pink line. What does it say? Breastfeeding with plain water? Is it the complementary feed that we want to give? Breastfeeding and non-milk liquids? Breastfeed and other milk formula? So only a small subset of patients get breast milk and complementary feeding, which means a must when we are giving advice to it. And very few are completely taking care of their advice of dietary diversity. And mind you, the amount of work will be shown by just this side, that only 6% of our patients get a minimal acceptable diet. 6%. So 94% is a huge figure, and only 9% get iron-rich food. 91% do not get. So the amount of work for 94 and 91% is huge, mind you. So kindly, I humble request to spend a little time. I had released a video of complementary feeding, 6-minute spending at 6-month visit, where the patient comes to you at flu shot, for the flu shot. It's a healthy, happy child. Mind you, spend some time for that, and also don't lose an opportunity to talk about early childhood development. We'll talk about it also. Vitamin A, let's come to some of the important micronutrients and the practical tips for that. All of us know that the animal sources of vitamin A are much better. They give retinol. But the plant-based sources are also not bad. And we need to talk about only 4 colors, the G, Y, O, R. The green, yellow, orange and red will actually give you, so it's a blanket recommendation, even if you do, that eat something of these 4 groups, I'm sure the child will not have vitamin A deficiency. But the discussion is so much on hypervitaminosis A. People have been questioning about really do we need a vitamin A supplementation program at national level. You must have read about it, and what does the science say? So there are only 3 conditions wherein you actually need to give vitamin A. A SAM child, actually a vitamin A deficient child, or measles. These are the only 3 conditions where we actually need to give it. But what is the actual ground reality? More than 20% population, if it is vitamin A deficient, we call it a deficient state. Fortunately, Maharashtra doesn't figure it in. Jharkhand, Telangana and Mizoram are the only 3 unfortunate states where a lot of work needs to be done. But it is a subclinical deficiency of vitamin A which we need to be really careful about. Fortunately, we don't see not even night blindness, forget the bitot spots or the keratomalacia. But at the same time, let's see what is actually, again, the vitamin A consumption in our country. So look at this. This was a study shown the consumption in rural or urban area. And this is from 75, the studies have been done up to 2011 and 12, and the figures have not moved much. So you know that staple food, none of the staple food will give you vitamin A unless you enrich it with something from the milk, the green YOR, you will not have vitamin A, and the child will have that subclinical deficiency, which is bad. And the figures remain same. So it was always questioned, do we really need it? So what is the final answer for that? Routine supplementation to all, should we stop? The questions are asked. So whenever there is a vitamin A deficiency, immediately supplementation, popping up a pill is perfectly all right. A medium term solution will be food fortification, we'll talk about that also. But a long term, which will take a lot of time, about behavioral modification, government directed horticultural derivation, it will take time. But what will happen? Will we cause hypervitaminosis A? That has been asked by everybody. And this tells us all that if a society has a normal diet, plus the fortified oil and milk, and plus vitamin A supplementation program, then only the risk of excess intake is about 30%. So only normal diet or a fortified oil and milk, which the government is planning. In fact, some of the states already milk is getting fortified. Maharashtra, unfortunately, still I have not come across any brand which is fortifying with vitamin A. But mind you, unnecessarily doing all these 3 is the only way where the hypervitaminosis A can cause. So government needs to continue. And then the biggest advantage which is told by its supplementation program is all-cause infant mortality reduces by about 12%. But mind you, infant mortality, the large chunk comes from neonatal mortality, which is actually unaffected by vitamin A supplementation program. So that always needs to be remembered. And it is always the preformed retinol which is going to cause hypervitaminosis A. So don't just go on indiscriminately giving vitamin A. The large levels, friends, take time to fall, resulting liver damage is not at all completely reversible. So always whenever advice about this is given, but fortunately the plant-based diet, the beta-carotene is not out alone. All of us have seen sometimes the child who is taking excessive consumption of carrot has complete orange hue to his body, but then you stop it, it gets completely automatically corrected without causing any damage to liver. So that's the beauty about a vegetarian source of vitamin A as compared to the retinol part. Talking about anemia, everybody is working about it. I have just now heard Dr. Sandeep Kadam has done a great job in the rural areas for reducing the anemia. But why are we struggling? It's because of the definitions that we have forgotten. What is it, the definition? A child who is less 10.9, a 3-year-old child, is actually anemic. Do we consider that? A child who is having a hemoglobin of 11.9 and who is 12 to 14-year-old is actually anemic. So we need to remember the figures of 11, 11.5 and 12 for these 1 to 4, 5 to 7 and 9 to 14. So these are the figures wherein below which the child is actually considered anemic. So instead of concentrating on hemoglobin, it is always considered the RDW is a much better and much earlier sensitive indicator for picking up of anemia. And then this simple mnemonic tells us all, the jaggery. You consume everything. So J stands for actually jaggery. A for ascorbic acid. All of us know limbu pilla varan bhatavar ki vitamin A and iron and everything gets better. The G stands for green leafy vegetables. But the fourth G, please remember, this is a garden cress seed or what we call as haliv. 10 gram of haliv will give you 10 milligram of iron. Do we ever know that? So whenever given 8 milligrams of iron you need to give, so just 10 gram consuming alivache ladu is absolutely not difficult. So let's remember that. R stands for resins and the final I is for iron vessels. The E in between is for the extra iron that we always know, elemental iron from the medicines that we get. So him is always 3 times much powerful. The non-vegetarian sources are much better. All of us know about that. But too much of milk consumption, and we have all seen that the child does become anemic. So RTW of more than 14.5 is an earliest indicator which needs to be noted. So if you just go on following only hemoglobin, 12 to 27% of these patients would be missed if it is just used as a surrogate marker. And then finally, Anemia Mukt program, a great program. Absolutely a big round of applause to everybody in the government for really implementing and all of us for following. But you and I, our role, has it we have every delivery room where we are attending, a delayed cord clamping in newborn for about 3 minutes or till the pulsation stop. Such a simple intervention has caused dramatic increase in the hemoglobin levels of that newborn. So we give that jump up start to the newborns, but just by simple intervention. So let's everywhere we are there attending deliveries, talk about it and see to it that it is implemented. Rest of the points are already taken care of in various programs. Let's come to B12 and folate. Look at the levels of adolescents with folate deficiency, 37%. I'm talking about prevention of neural tube defect for the adolescent. We need not have a single adolescent female who is deficient in B12 and folic acid. We know B12 problem of vegans, always if you're a complete vegan, you will have B12 deficiency unless you consume something of that. But same thing happens with folic acid. But there is something which we need to be careful about folic acid. And what is it? We talk about neural tube defects, but do we know the dose of folic acid? It is just periconceptual consumption of 400 micrograms of folic acid. And the tablet of folic acid, friends, is of 5 milligram. So maximum dose which a woman requires, adolescent or pregnant, is 1 milligram. So why are we giving those extra 4 milligrams? You would say, does it cause any harm? Even if a child who is born in the family who is of neural tube defect, or the mother is taking anticonvulsants, the dose of folic acid goes up, accepted. But how much? It is only 4 milligram. So we need not have a 5 milligram tablet. And I'm in my tenure going to try to plead with the pharma industry to reduce the dose of this folic acid not required. And what harm it does? This is something called as a folate trap. Extremely important, very easy to understand, though the slide looks like something too scary about. What is it? I get folic acid from diet, which gets converted into tetrahydrofolate, which is a precursor form into which ultimately gives us everything advantages of folic acid. But if I consume extra folic acid continuously, what would happen? It gets converted into methyl tetrahydrofolate, which is useless for the body. It just gets accumulated. And to get it back into circulation, if you want methyl tetrahydrofolate to come back to the crucial precursor form of tetrahydrofolate, what is required is B12. And we know already the deficiency of B12, clinical, subclinical. So what are we doing? And this is what is called as a folate trap. So mind you, this is what folate does. So even if you are consuming folic acid periconceptually, this point needs to be remembered. Vitamin D, yes, sunshine, vitamin, everybody knows. We talk about vitamin D. But how many of us really give this advice? We know that Indians have so many, disadvantages as far as getting vitamin D actually from sun with the traditional clothing, the skin pigmentations. Yes, we are at disadvantage. But are we spending time in talking about this? That the time is between 10 to 3. We are talking about UVB rays, not UVA rays which get just scattered. And 10 to 3 is the time. Dr. सकाळी 7 वाजता आम्ही अर्धा तास ठेवतो. नाही त्याचा काय उपयोग. So it is 10 to 3 for 10 minutes. That is good enough for getting your own vitamin D which is from sunlight. So we need to spend time. And overdose. I talked about the maximum upper limit, but don't forget the tolerable upper limit. Gene mutations, excessive vitamin D has been shown to be 20% of our breastfed babies, friends, get vitamin D. We feel that we are telling everybody, only about 37% of pediatricians actually prescribe vitamin D. Sounds so absurd. You may say, how is it possible? Each one of us actually gives at birth to every child. No. And finally, about this nanogram per ml, and this is confused, nanomoles. Now, if a level is 22 of nanograms per ml, and you know about only nanomoles, you would say it is 22 less than 30, the child is deficient. 60,000, घेतला आठवड्याला. So that is what happens. So now I know that only one figure that you need to remember, either a nanogram per ml or nanomoles. Don't get confused by that. That's about vitamin D. Zinc, fortunately, not much of a disadvantage, especially for non-vegetarians. It goes at par with iron, so it is fine. And supplementation, as of now, is recommended only in diarrhea. We do not routinely recommend even in COVID. But then, zinc, certain important practical points. Whenever a diet has extremely high iron containing food, more than 25 milligram, it interferes. Again, point to keeping your level of iron consumption in the diet normal. Calcium and copper inhibit, again, zinc absorption. Animal proteins and human milk help in absorption, but fortunately, nature is at its best, because even if the intake varies by tenfold, the GI system maintains. So routinely, you and I do not see zinc deficiency. We need not give supplementation only in diarrhea, or unfortunately, if we come across a acrodermatitis enteropathica or a SAM child, it's altogether a different case. Iodine, again, this is the only micronutrient entire country. All the levels, even 2021 reports have shown there is no iodine deficiency, thankfully, just because of the salt iodization which has happened. The national salt iodization, great. But what is the problem? Still, why are we seeing deficiency of iodine? Is only because of faulty cooking practices. So there are 7 to 70% loss happens. So salt is only to be added, most of the ladies know over here, at the end of your cooking, and maximum loss which we recommend is pressure cooking, boiling, and less in deep frying. So there are certain practical points in iodine. Even if it is there in diet, we still lose it. There are fortunately various programs for micronutrients, and all of us actually implement it in our day-to-day practice. We do give vitamin K to every baby. We give vitamin D. We talk about zinc only in LBW diarrhea or a SAM child. Iodine we talk about in universal salt. Vitamin A, 9 mega doses. Still the government is continuing. The final order is not at changed. Right now the program still continues. Iron, folic acid, life cycle approach continues. Folate continues. So mind you, over deficiency of micronutrient deficiencies, only 10%, 90% of it is hidden hunger, and that is detrimental. That is the one which is going to cause your cognitive impairment. That is going to prevent the child, and that is going to cause the child stunting. That is ultimately his adult daily loss, and then as an adult to the earning potential also, and finally the country is at loss. And this is the most exciting part I felt about micronutrients, is the epigenetic importance. The word epi comes from Greek. It is around, over. So actually in practical terms, implementing in addition to. So it doesn't change your genes, but still it influences what genes are going to do in the offspring. And how micronutrients come into play into this. Very exciting theories have been put, and actually it has been proved. Now methyl group donors. So these are the micronutrients B2, B6, B12, folic acid, and choline. These parts are extremely important. What they do, what is this methyl group donor business? I gave you an example about neural tube defect. So at 12 weeks, the neural tube which is open has to close. So something has to happen. So whenever a methyl group is donated by these micronutrients, the histone rings encircles those genes. And what happens? The transcriptase factors which are supposed to go to the genes, they are not allowed. See, tightly bound junctions, no, these factors will not go, and then the genes cannot express themselves. So it is like sunlight is there, but totally covered by clouds. And when the clouds go, the sun comes. Sun is always there. So this is what these do. And in absence of micronutrients, what happens is acetylation. The histone rings fail to cover, and then the manifestation. So your problems will continue. So this is an epigenetic form of, epigenetics is a great science. In fact, nutrition is only one part. It has been proving to have effect everywhere in child development also. But remember, the contribution of these micronutrients in epigenetics is also exciting. So finally, to say about food pyramid, we all learned in PSM Park this. Then came this in our almost end of MD days or early 90s, wherein it was shown that all micronutrients are equally important. In fact, all food groups. and they stand next to each other, non top of each other. Only the thickness of the band tells you how important, how much you should consume. But this was added, a great addition without exercise. Even if you have ample of sunlight exposure, vitamin D, the child is not moving, calcium, vitamin D absorption will not happen. So physical activity was stressed upon in this. And then US FDA came out with My Plate, wherein they have shown now 50% of our food plate while having lunch, please remember that, has to be gyro. Here only 2 colors are, but the GYOR has to be 50%. They have given brown for grains, they have given purple for proteins, it could be vegetarian, non-vegetarian, and finally blue for dairy. So this is the way, the rainbow of colors. If you decorate your food plate, I'm sure we are going to have a child who is not deficient in this. But then there are gaps. It doesn't happen even if you recommend. Unfortunately, fortification is the answer. It is going to come in exciting ways. So need of micronutrients, actual consumption, and bridging the gap. That is the only way. And which are the programs that we right now have in India? So food safety standards has wheat flour. What are the things which are wheat, rice, salt, oil, and milk? You may be staying in Kaf Parade, you may be staying in Pachpakadi, or you may be staying in Gantari. Everywhere, everybody eats all these 5 food items. So fortify them with iron, folic acid, B12, different ways. This is the way to overcome the deficiencies. Food fortification has 3 parts. Industrial, we can't control it, so they have food fortified, rice also. Home, the easiest one, you tell the mom, sprinkle that iron sachet, and then the child will be taking. It's like taking medicine, but still not really acceptable. And finally, bio came in a big way, that you actually change the crop the way you are growing, include them when the crop is being, seeds are being sown, and then ultimately the plant will have enriched with micronutrients. But then orange sweet potato came, and then people started feeling actually sweet potato color has changed. And patients do ask us when I talk about gyro, Doctor, आजकल गाजराना कलर वेगळा आहे, केळ्यांचा कलर वेगळा आहे. I am sure everyone comes out with this kind of solution. So what is happening? Is this addition of food additives a mass effect, and everywhere it is found to be beneficial? So last couple of minutes on the rainbow of colors in medicines, is it also recommended? So they add it for flavor, they add it for making, looking it more attractive. So there are certain psychological benefits when you take a colorful medicine. There is identification, manufacture and distribution, the company finds it okay. There is a uniform coloring happening, but unattractive medication ultimately becomes acceptable. Patient compliance also improves when he takes a colorful tablet, that is a human style psychology. But what are the colors are they adding? This is the one, tartrazine. It is linked with hyperactivity, ADHD, asthma, urticaria, B12 zinc deficiency, the cross sensitivity with so many NSAIDs. The second one is sunset aloe. Have you ever paused for a while and looked at the bottle or the medicine, that the colors that are added into it? Urticaria, rhinitis, nasal congestion, hyperactivity, abdominal cramps. And then finally the carmoisin. This is most notorious of them all, which is carcinogenic hyperactivity, banned in countries like USA, Austria, Norway, and Sweden. Then I came across this report, a common brand of paracetamol which has this carmoisin present in it, and what it does, it's a fixed drug reaction type of things that the patient, 5-year-old child. So these patient reports, we do come across in various journals. Finally, erythrocin, this is another one, inhibitor of dopamine activity, resulting into hyperactivity, childhood hyperactivity, erythroderma, so on and so forth. And finally, a ponchu, which is an animal study, which is linked with so many other things, and oxidative damage, again banned in some countries. So actually patients do ask us, and all of us have that thing in our mind, do really food additives and these coloring agents have anything to do with ADHD? So this is the final verdict as of now. Medicine, you should always say, as of now, as of today, that this artificial colors and flavors present in medicine, what they do, the behavior of children is definitely altered. It's an area under investigations. Although some studies support a relationship, there is found to be, but ultimately they do not prove that food additives actually cause ADHD. Most of our patients, ADHD, it's a simple recommendation. रंग घातलेल्या गोष्टी देऊ नका, medicine देऊ नका, बाळ जास्त hyperactive होईल. Is it really true? So no major practice guidelines, none of the Indian, American, European say that this management does not recommend routinely elimination of food additives in the management. So there is some role, there is some support, but finally it has not reached a stage where it should become a blanket recommendation. So we have an alternative live. We have natural colors with us. So many of them there, and then that they can always be included. So look at the carotenoids. Look at the color and the sources, the sweet potatoes, spinach, tomatoes. They can give, and of course they have antioxidant load. The carotene, all of us know, comes from carrot, yellow, orange fruits, rich in vitamin A. The natural chlorophyll, every plant has it, such a wonderful green, soothing color, occurs in all naturally in plants. And finally, the curcumin extracted from turmeric. Why do you want to pop up pills for that? And the number of benefits of halad are just increasing every day. Riboflavin, of course, B12 comes from leafy vegetables, eggs, and then also that also is a wonderful natural source. And sweet orange oil, fruit peels. I am sure many of you also have that tasted the peel of orange peel and then taken aroma with that. And chocolate flavor, children love it, everybody loves it, cocoa seeds, psychological benefits, patient compliance improves. So I think this is the way when if there is a natural resource available, there is no need of actually going for artificial flavors and colors and additive agents in all of these medicines. So to sum up, friends, let's get back to the first part of my talk, that micronutrients, small amounts, vitamins, mineral, trace elements, but extremely powerful deficiencies hidden. Folate, choline, iron, iodine are extremely important micronutrients for mother. Vitamin K and D, everybody at birth should receive a prescription of that. Utilize your 6-month visit to talk about the different food groups, to talk about the rainbow of colors in the food. So 6-month visit is the time. 6 months exclusive breastfeeding takes care of almost all deficiencies. Even if the iron is low, bioavailability is excellent. I feel 6-month visit is the time. So I say 6 minutes, you may spend 10 minutes. Child doesn't have any issue, he has just come for a flu shot. So please dedicate some time. Vegetarians, of course, need some special, because even iron, proteins everywhere, none of the vegetarian proteins can at par the biological value, the net protein utilization, nothing is at par with the non-vegetarian. But the different combinations, that is what needs to be emphasized. Your will take care of your vitamin A, and then of course the brown, purple and blue will take care, provide rest of the micronutrients. So actually what we are talking about, India wants to become a developed nation, and there are certain protocols and then certain prerequisites for that. First is elimination of hunger, and then second is elimination of poverty. There is elimination of gender discrimination, and there is peaceful society. So these are all prerequisites, and for all of which we need to have a society which is not deprived of certain micronutrients, not deprived of love and affection what the child deserves, and ultimately we provide that. A comprehensive holistic approach in child upbringing will ultimately give a wonderful citizens at 18 years of age. Thank you very much.
Thank you, sir. We have really experienced Rambo of nutrition. Any questions from audience?
Omega-3 fatty acids, she said, you must talk about it. So all of us know that there are a number of recommendations of utility of omega-3 fatty acids, but basically it has been found for brain, retina and reproduction. So these are the 3 areas where it has been proved beyond doubt. But we do not recommend any supplementation of omega-3 fatty acids. It should be dietary sources from vegetarian as well as non-vegetarian. So we all of us know that. But then a routine supplementation of omega-3 is big no-no. There are a number of baby food manufacturing companies which come and tell you that we have added this kind of omega-3 fatty acid, that's an advantage over others. No. So a dietary source, of course, with a proper ratio, it's not only 3:6 is also required, but the proportion is required in the ratio of 1:5, and then only we'll be having. But then it doesn't come into, because it's a part of, fatty things, so it doesn't become a micronutrient, so that's why I did not talk about omega-3. But yes, point well noted, but no supplementation, no extraneous sources, always recommend dietary sources, extremely costly.
Thank you, sir. Colors are not only important in life, but in our plates too. Who could have explained more better than you, sir? Thank you so much. Now I request Dr. Ramgopal, sir, to please felicitate Dr. Upendra Kinjawadekar, sir. On behalf of TAPICON, we would like to felicitate our chairpersons for this session, Dr. Ramgopal and Dr. Sachin Biradar.